Hi, welcome to another episode of the Opposing Points podcast. I'd like to welcome Justin Spiro, a licensed clinical social worker, to the podcast. Welcome, Justin.
Hi, thank you, David.
I found you on Twitter. I follow Monica Gandhi. I think she liked some of your tweets, and I followed you because I just thought you were tweeting interesting things and getting yelled at. So I like to talk to people like that. Can you just give me a bit of a brief background about yourself, like what you do, and how you kind of got into this whole fiasco?
Sure. So, I think we all got into this fiasco together just by
Yeah.
COVID happening and the disparate responses of different cities and states. But I'm a school social worker. I've been a social worker for over 10 years now, working at my current school for 8. Before COVID, I still love my job. I've always loved my job, and my job really is working with kids, both in the individual capacity, but also group wide, groups, school wide, class wide, and all of those different dynamic settings and combinations that really weren't possible for the 18 months when schools were functionally closed.
Awesome. So what's kind of made you want to be a little bit more vocal?
Well, I really started getting vocal, I would say, early last school year, like last fall, when, you know, I saw then the argument wasn't about masks and quarantines. Then it was like, are we opening schools at all? And if we are we letting kids come in more than like 3 hours a week? Like literally, some high schools were letting kids come in one day a week for 3 hours because they had to conform to these very strict, rigid 6-foot rules. Like, God forbid a kid be 5 feet instead of 6 feet from another kid, right? That could, in some cases, that could allow 2 days or double the amount of time they're in school. But because of these 6-foot rules and podding, they couldn't be in the same room as anyone that was not in their official pod. It really made school a skeleton of its former self. It shaved off so much that it wasn't even really school. It was, you came in for a few hours once or twice a week. It became an option. School became an option last year, became a part-time thing. And so I really started speaking up then that, we're allowing indoor dining last year, long before vaccines, but not schools.
Mm-hmm. Yep. The 6 feet rule, funny enough, was like arbitrary. They were looking at
Yeah.
9 feet. Some places like put 3 feet, and it became so inconsistent and hard to follow. I was in New York City during this whole time. I remember at restaurants opened and closed and opened and closed like twice, I believe.
Yeah,
But
something like that.
it just got a little nuts. And I really like your Twitter byline. I don't think it's political, although I saw someone tried to make it political and call you like a Trump supporter, which is just insane. That's just what you get labeled when you say something that's the opposite of what everyone else is screaming at you. So your Twitter byline is like, after 2 years of chaos, kids deserve a normal school year and a normal childhood. And somehow that's controversial. What do you make of that?
I mean, I think it's the same thing last year, right? Like, everyone gets very defensive. So last year, to even utter the words that kids do better in person and that remote learning really isn't school, all these teachers who, to be fair, were working long hours on Zoom, got super defensive and said, "What do you mean? I'm working all day. I'm on Zoom. I'm reaching out to kids desperately." And I'm like, yeah, I'm not. No one's saying you're just sitting, on your butt doing nothing. But you teachers, and including myself as a school social worker, we're spinning our wheels, and maybe even more that work, making more outreach than usual, but accomplishing less than usual. And that's not to blame the teacher. That's not to blame me, but it's to blame the policy decisions. That is to blame maybe the unions that influence the policy and the policymakers. But yeah, so to even acknowledge last year that remote learning was not only less than ideal, but really ineffective, was viewed as political. And this year, to acknowledge that, like, masks have downsides and that kids, it's better for social and emotional and learning reasons for kids to see their teachers' faces and to see each other, teachers to see kids' faces, to even acknowledge that basic reality. It makes, oh, you must be a Trump supporter. You don't believe that COVID exists. It's like two extremes.
So given the lower risk profile among children, you tweet about this a lot, versus young adults crowded in bars. In terms of your profession as a social worker, what is the psychological harm that you think that we're seeing versus like the threat of COVID? I mean, I think we saw a large increase. I'm not sure of the numbers in terms of like childhood obesity during the pandemic, as well as adult obesity, which has already always been a problem. So can you touch a little bit on some of those harms that you think might be existing?
Yeah, I mean, you definitely could make the one-to-one comparison between COVID and other physical ailments like obesity. I'm sure, the harms of obesity are far outpaced any childhood COVID outcomes. But on a mental, social, emotional, and academic level, it's like kids are broken, right? Kids don't know how to function.
Mhm.
They're getting into fights. The ones who are naturally more aggressive are everything's exacerbated. They're getting into more fights. The ones who are more anxious and depressed are even more anxious and depressed. Don't want to come to school, or they come and don't talk to anyone. They don't know how to make friends, don't know how to talk to people. For 18 months, it was almost like it was Orwellian that we called this school. Like, how did they get their attendance taken last year? By logging onto a Zoom for at least one of their 8 Zooms for at least 5 minutes, where their camera and mic were off, and they were in school that day. It's like, what do we do? So we taught kids that's what school was like. So we taught kids school was an option. They checked out of school essentially for 18 months, many of them, and now that we making them all come back, and they're just in shock. Like, it's a lot of work because last year a lot of the courses might have been watered down, and you couldn't really give a test. Everything was open book by default
Right.
if you're at home in front of your computer. So now they have the academic, social, emotional demands that have been typical. High demands we expect of high school students or any grade, and they don't know how to deal with it. They lost those horribly lost those that year and a half.
Yeah. So what coming across your profile made me think about that I hadn't previously before, other than like the isolation and the masks, is that I think schools are sometimes a place where you can identify problems at home or physical abuse that might be going on. Is there anything that you've noticed around that issue?
Well, I mean, I don't think it's so much like abuse that was directly related to the pandemic, but yeah, whether it be abuse or neglect or being a victim of some other trauma or crime that was not perpetrated by a parent, or just having any other kind of horrible life experience, which in a city with a million students, right? I work with teenagers in a city with two or 300,000 high schoolers. Of course, many of them are going to have those life experiences in any 18-month period,
Right.
and they're not comfortable. Whether it be something as simple to me and you, but as very serious to that kid experiencing it, as coming out of the closet, or having or experimenting with drugs, or whatever it may be, and not having a trusted teacher, counselor, or social worker to talk to about it. No one's going to click on a Zoom link or email their school social worker to talk about it. What makes it so effective is that I'm embedded in the school community. I'm in the hallways. I'm in the cafeteria. I'm standing there before school, after school. Kids literally can walk up to me, make small talk, and then it develops to something like a more serious conversation. None of that was possible for 18 months. So yeah, you're seeing kids not only struggle with pandemic-induced anxiety, but also whatever natural anxiety and trauma you experience in 18 months just went undetected, unreported, and untreated.
Yes. And one other thing related to that sort of emotional trauma. Um, you mentioned something about racially motivated or racially based enforcement of masking rules, I believe, on Twitter. Um, and I was just curious if you could educate me a bit on that.
Well, I wasn't speaking so much specifically about masks. I was parroting the well documented, unfortunately, implicit biases of educators, specifically white educators nationwide. I don't know if it's more pronounced in one city or state or another, but we learn about the school to prison pipeline. It's well established that unfortunately black and brown students, especially boys, are targeted more for disciplinary consequences. This is long before COVID,
Mhm.
right? So, kids are cursing in class, or kids are even getting physical with each other. If you look at it nationwide, Black and brown students are more likely to get more severe consequences, a suspension versus detention, or detention versus slap on the wrist. So I don't have, and there won't be any data, I think, about anything COVID related for months or years to come with regard to this. But I was extrapolating and saying it's not hard to imagine the same thing might be happening with masks. That just as Black students who are calling out in class, documented phenomenon that unfortunately are quieted down or reprimanded more often than white students. The same thing, this is just one more rule a school has to enforce that may be disproportionately enforced against minority students.
Right, that makes sense. And in terms of masking for maybe kids that need facial expressions to learn, or they have some learning disability. How what have you seen around that?
Yeah, I mean, at a certain point, it gets absurd, right? Like my high school, I think many high schools in the city are at a 75, 80% plus vaccination rate. And you have students who have hearing impairments, students on the autism spectrum who have, sensory issues themselves with a mask, as well as needing to see the facial expressions of others to understand emotion better. Or even honor students who are in AP calculus or AP physics, really hard classes, and the teacher's trying to explain a really complex topic. Just like you're looking at my facial expressions now as I'm speaking in an animated fashion with you,
Mhm.
right? When you're explaining, I don't know, derivatives or whatever that was I learned, 20 years ago in high school, right? Like it's much easier to understand the teacher explain that if they can be fully engaging. So it's not the end of the world. And in April 2020, when we instituted masks, and we didn't know anything about it, okay, it was a fair price to pay. Um, but now it's like, especially like in small group settings, like there's also no nuance and no flexibility. Like a speech therapist who literally, by definition, is teaching kids how to speak. There's no dispensation that a fully vaccinated speech therapist can't unmask in front of a student, even a fully vaccinated student. Like there's no, even outdoors, even they could be beautiful day, they could have a session outdoors, vaccinated speech therapist, vaccinated student, even sitting 3 or 6 feet apart. There's zero dispensation to remove a mask. There's zero flexibility in our rules.
Yeah, I mean, I can barely even hear the cashier at Chipotle when I'm like right in
Yeah.
front.
And
um,
thankfully you don't have to, right?
right, right, exactly. Are you seeing any difference with what you just described here versus other countries? Are you aware of how it may be done differently?
Yeah, I mean, I'm not seeing it because I'm not really only in New York, but I'm
Right.
I'm hearing about it, I guess, the same way you are. Like, yeah, that in Europe, I know now with their huge surge, they are reinstituting masks,
Okay.
some settings, some capacities, but by and large, many countries never mask kids under 6, some never masked under 12. Um, and for sure for vaccinated teenagers, it's like a non-starter. Like vaccinated teenagers may be the safest human beings on planet Earth because
Hmm.
unvaccinated teenagers are at lower risk than vaccinated 50-year-olds. So a vaccinated 15-year-old is like unbelievably safe, yet like even sports, basketball, wrestling, where everyone on the sport team has to be vaccinated in New York, they
Hmm.
have to be masked also. And yet their parents at orders of magnitude greater risk of them can go to bars and crowded bars and whatnot.
Right. Yeah, I think that's just wild to me. And among that, I feel like we've seen the sort of othering of children, like as like disease carriers, which is what, like you said, they're extremely low risk. Um, and it's just weird to me how we've gone as a society to that. I don't know if you've noticed that, like, hey, you kids, you are dirty and like you must stay away from everyone else. And by the way, I'm gonna take 10 shots at the bar, be right back. Like the,
Yeah, I mean, to be fair, I don't think that's anyone's like explicit intention, but I
right, right,
definitely can
right,
see how it could come across that way because yeah, like adults can do anything. Kids have no agency.
right.
Like kids have no ability to like. And the science is clear; they are lower risk themselves and less likely. Most cases are spread from adult to kid, not kid to adult. But even taking the science out of it, like, it's not kids' job to protect adults. We asked them that amazing sacrifice, don't kill your grandparents before we had vaccines. Now every grandparent could get 3 shots. 25% of New York City residents 75 and older don't even have 2 shots. So, like, that's where the focus should be. It shouldn't be like, oh, like, because we haven't gotten all the vulnerable seniors vaccinated or boosted, we're going to mask kids forever, even while we're letting middle-aged adults do whatever they want.
So I think related to that, there's been a couple of colleges that were, had 100% of the student vaccinated, maybe save for some exemptions. And they were still under pretty draconian measures of lockdown. I'm not aware of any that may have died there. And it almost like, what is the sense of such a policy, like of an off ramp for this thing,
Right. I guess, like, hey, look, I'm not an epidemiologist.
Right.
I'm speaking about this from the mental health side. Of course, there is the medical health side, but I lean on people like Monica Gandhi, as you mentioned, and Joseph Allen, and some of the other medical experts that have been writing about this. Like, in order to have an off ramp, you have to, like, have a goal in mind. And people, I forget who had this quote, but someone said that, like, we're sleepwalking into policy because we don't have an end goal. So it's an off ramp from what? We don't even know which ramp we're on. If is our goal no infections? Well, that's not possible. Is our goal no deaths? Unfortunately, that's not even possible. If our goal is to get down to a sustainable level, okay, so define what that and level of what? Of deaths, of hospitalizations, of unvaccinated hospitalizations, of whatever you want to define it as. But if in a fully vaccinated college campus, again, it goes back to, like, what are we doing if in the same city 50-year-olds could be at a bar, and that bar night is going to result in a lot more hospitalizations than a group of 19-year-olds or 12-year-olds getting together with or without masks, with or without vaccines. So if the 50-year-olds are getting together and in the bars, and unfortunately leads to some breakthrough hospitalizations, and now are we going to use those to double down and blame the 19-year-olds? Oh, look at all hospitalizations in our city, we have to keep you guys in masks in classes. Doesn't really make sense.
Yeah, I think Monica has written about that. Marty McCary has written about that. Those have been like the two people that have just seemed not insane to me on Twitter. That I'm like, okay, what information like can I trust? And yeah, and like she still gets a lot of hate on Twitter. At least it's Twitter, but it's pretty incredible to me that she faces such that, and we're seeing, like, politicians on both sides, like just chilling. We had Nancy Pelosi officiate this like huge wedding, like huge, and it just gives off this, or they have their wait staff at their donor events masked, or at the Met Gala,
Yeah.
they're all masked, and it's just like, it's crazy to me that it just it kind of just casts away the poor, I guess, almost.
And even going beyond that, like, I remember thinking back to, I remember thinking this a year ago, election night. Most people focus on the results, as was I. But last year on election night, before vaccines, on CNN, you have 8 people unmasked, obviously unvaccinated at that point,
Mhm.
in a room together, and maybe they all took rapid tests. But it's like, how did they have access to rapid tests every day in November 2020, and we still don't have ready access to rapid tests as a general population a full year later?
Mhm.
And rapid tests aren't perfect, and if you're all unvaccinated, and these are all 50-year-olds, or there is some level of risk, and they can do so. Maybe that's part of it also, that the policymakers and the media reporting on the policymakers never really experienced the policy themselves.
Yeah. I mean, we see examples of like, the cameras go on and they put their masks on, and like, I get the message, like, wear a mask, but like, that's all recorded. And if you want to create like skepticism, that's what you do. Like, what's been going on is how you create skepticism, and then they yell at everybody like when they're skeptical. I think that's something that we've seen.
Yeah, yeah, definitely.
Yeah. So have you what impact have you seen on athletes aside from having to mask? I was thinking about this. A lot of people that go to college depend on like athletic scholarships. Has there been any impact around that? Like, I know you mentioned like parents are at games, but I don't know how recent that is. Or
That's a recent change. That's a
okay,
recent change that, um, and actually, I was tweeting about that like about a month ago, and they had a rule in place that you couldn't have any visitors. It was so insane. Fully vaccinated basketball players with masks on were being treated like a COVID ward and could not have another vaccinated masked scout in the stands, which literally could be life saving. That could help a poor kid get a scholarship. Um, and I remember I tweeted about that, like I was at the Ranger game, showing a packed Madison Square Garden,
yeah,
maskless. Colorama of Channel 11 did a story on it. Other people did rallies and stories on it. And then a week later, the mayor changed the policy and they allowed not just scouts, but any visitor who wants to, watch a game could watch a game. They also changed the rule this weekend that you could play against non-New York City teams as long as they're following the same rules, but many of them will not be following the same rules of requiring vaccines. So yeah, athletes are still subject to some restrictions, which it just doesn't make sense to me because, all athletes are pretty low risk by virtue of their health, but the 15-year-olds are definitely much lower risk than the 35-year-old professional athletes, and they have no restrictions. So
yeah. I
I
don't
get
think
it.
there's been a case. I haven't seen a case of an athlete dying from it. Like Kyrie is unable to play, right? And there's been a lot of like I think people broke into the Barclays Center. Like it's just people have gone kind of nuts over it.
Yeah.
Um, that's actually one of my favorite things that you do on Twitter is to hammer home with that. Is just like take pictures or have pictures of crowded places. Like why are kids still in that? Why are kids still
Yeah, I
wearing?
mean, a picture's worth 1,000 words,
Right.
right?
It says so much more to point that out to people. I think it's really important. Um, so I think there's a wide spectrum of people, and we kind of get cornered or pigeonholed into what end of this political spectrum, like, oh, you're a left winger, you're a right winger, you're centrist, and it's just kind of crazy to me that you can be a what's that, dyed in the wool liberal they call it or something like that, and
Yeah.
say one thing that is a popular idea on the opposite side, and you are like suddenly labeled. Like I was joking with you the other night when we were organizing this, that I was going to message you like, have you gotten any like accusations of being like something you're not, like a crazed right winger or something like that? And I literally was going to check your Twitter to message you that question. I was like, can we discuss this? And then lo and behold, like 54 minutes earlier, you had already responded to someone saying that to you. Like, what has that backlash been like personally? Like, when you're being accused of being things that you're not, that you're maybe are far from.
I mean, I feel like I'm at like really like an ideological island many times where like I'm very, here's one irony that I haven't tweeted it because I think it's hard to really capture it like in the limits of Twitter.
Yeah.
That a lot of the right wing parents, so to speak, or more conservative individuals agree with my points or my followers, but ironically, one of my fears over the 18 months was that let's say gay kids or trans kids who are living with conservative, perhaps unaccepting parents were stuck in that situation without support. But it's those very parents who support me in wanting schools open for a whole variety of reasons. They get it. Whereas the liberals who would before COVID would have wanted to support, LGBT kids having an outlet. Now, like, no, close schools, restrict or masks it forever or whatever it may be. So it's just like a weird, so many strange bedfellows on both sides that I feel like I'm caught in the middle.
Yeah, I mean, I spoke recently to Denisha, who the podcast of that will be going up in a couple weeks, and she founded Black Minds Matter, because of her personal experiences, and so one of her things is she's in favor of school choice, and like people just like start calling her like a mouthpiece for like white supremacy and stuff like that, and like those insinuations. And it's like this person is just seeking what they've seen works for them and for their community, and because they think differently or they have an idea that is consistent with an idea of a people they don't like. It's like if Donald Trump likes chocolate and you like chocolate, that
Exactly.
makes you a
Yeah.
bad person. And it's just, I don't know, the nuance is just gone from society. Like from when I was like, I'm 28 turning 29, like it's gone. Like when I was a teenager, this sort of nuance was fine to believe in.
Of course, yeah, and I mean, and especially when I spell out the reasons why I think masks should be optional. We have a high vaccine rate. I'm not saying the vaccine is a hoax. I'm not saying take ivermectin. I'm not saying inject bleach. I'm not saying Donald Trump should be president forever or ever. You know,
JFK will
um,
be back again, or JFK Jr.
right, I'm saying that like, and then people say, oh, you probably don't care about actual body image issues or actual social issues. Actually, like that's for me, it's consistent with maybe some people on both sides don't, but like I I believe what I believe. I think this is consistent with what I've always believed, and yeah, and I've pushed back on both sides from the far left saying, well, not even so far, unfortunately, saying, if you even question masks, like you're a bad person. And now, like just this morning, I tweeted about these people wearing these gold stars, like saying I'm unvaccinated and comparing to the Holocaust. And people on, I don't even, I guess on the right, right, are criticizing me, saying, "Oh, but Justin, you don't realize it is like the beginning of the Holocaust. You just have clearly have no Holocaust education or awareness. Should probably go to Yad Vashem to learn how oppression of Jews is different than oppression of someone's vaccine status. But we just are so extreme on both sides.
Yeah.
It's kind of lonely in the middle.
It is. It's like it's so important to have a healthy conversation and respecting the other person. But we throw around terms like that are just like, oh, anti-vaxxer because you have questions about why we're still masking teens, or like or people that believe in vaccines but not mandates are now labeled as anti-vaxxers. And we just kind of adjust the language in such a way that we alienate people that actually want to get things done and not like put their stakes in the ground. Um, it's just dangerous. I think in terms of how the school union is handling this, do you think that's had, is there any union lobby power that may be involved in keeping schools closed, or
Definitely.
also like de Blasio in New York has relies heavily on lobbyist support, right?
I mean, a year ago this week, schools shut down citywide because of a union agreement of a 3% with the city. When we reached 3% positivity rate, we'd shut down. For me, my most frustrating union moment, and this also is, it's hard to tweet about because it's many more than
You can get it all out here.
yeah, 30 chapters. But like last spring, when we were up to 2 days a week. We got kids in school 2 days a week with a 6 foot distance, like measuring exactly 72 inches between desks. And we managed to get in those kids 2 days, 2 half days a week, I should say, like 3 hours of school because of the potting. And we realized that there were some classes, some pods that had some empty seats. And so I thought to myself, great, let's take the kids who are the most struggling learners, whether it be emotionally or academically, and let's say they're A day kids. Let's put them in on the B days also. The seats are there. They're still within 6 feet of everyone. And remind you, this is after every teacher had vaccine access. They're within six. They're not within 6 feet of each other, even. Never mind the teacher. Um, and I got pushback from the UFT. The union said, no, you can't do that because the agreement was that the A day kids only attend school on A days, as if they're more infectious on B days, or as if them being in a pod or breaking the pod seal and being with B day kids. Remember, they're still 6 feet from everyone wearing a mask. 6 feet, and the teacher could be more than 6 feet from them. And that vaccinated or vaccine eligible teacher um, had the union right of only having to see her A day kids 2 days a week, even if there was room on the other 2 days and kids. So that just for me was like the last straw. It's like, what are we doing here? Are we defending some rigid, arcane like union rights, or are we letting kids learn and do what
Yeah,
they?
it's almost like the policy is the like God's word, and you can't defect
Yeah,
from it. Like I remember I went to a wedding reception or dinner, right? And when I stood up, the waitress like reprimanded me to wear a mask. Like I stood up like above my chair, like just in my chair, like hovered
yeah,
above my chair, and then I sat down and it's fine. And like it doesn't really make sense. It's like we're so strict on this, like, oh, this is the policy. This will 100% prevent any sickness. Like kids must do this. It's strict adherence, like it's God's word, I think.
yeah. But and honestly, like I tweeted about this also. Like I will, I have no problem, and it's completely silly, but like it's really at the end of the day not like the end of the world if
Mhm.
I am masking going to a restaurant bathroom.
No, it's
But
absolutely not. Mhm.
but for kids, right, to have their school shut down because of these ridiculous protocols, or like shutting a school for 24 hours for disinfecting, which is like some theater is silly and some theater is downright harmful.
Mhm. Um,
So yeah.
yeah. So to get a grasp, um, to handle this in schools, like what now that we know could have been done differently? I mean, I think obviously when we first had to deal with the virus, right? We're like, all right, I think it was reasonable maybe to close down and see like who this
We
was
didn't know.
affecting,
Yeah, we had no
right?
idea.
So once we kind of knew that this was affecting people with comorbidities, largely obese, diabetes, other things like that. What do you think would have been the way to go in terms of getting kids back to school?
I mean, oh, you don't have to reinvent the wheel. Look at the red states, or look at the private schools in the blue states, in the blue cities. The um, right here in New York City, the religious schools, the private, non-sectarian schools
Mhm.
were open the entire year last year. They broke that sacred 6 foot seal, and nothing happened.
Mhm.
Right? They wore masks. I feel like we're a year behind. Last year we should have been fully open with masks. This year fully open normally. But last year we were barely open at all. But you look and like that's why it was a union thing, and it was so absurd where you many times had schools closed and kids attending remote school supervised by non-union childcare workers at some like remote learning hub they called them. But if the private schools could be open, so what? The kids were 2 or 3 feet from each other. They were wearing masks. They were learning, and full day every day, all week long. Whereas in the public schools, we couldn't squeeze in more than 8 kids at a time because of these ridiculous rules.
Wow.
So
I think
we knew this 14 months ago what we could have
right,
done.
right. And so the other thing, 14 months is such a long time. Like if you take right that if would that have included a sophomore becoming a senior, right?
Yeah, I mean, so this current senior class left March of their sophomore year.
Right. So that's like a maturation issue,
Yeah,
right? Like
and
you
then
just,
junior
oh, I'm
year,
in
like
college now. Like,
yeah, and like junior year is like a tough year, but they didn't have that, and like now they're struggling senior year. The current juniors are having their tough junior year, having never had a sophomore year and just had a few months of being a high school freshman.
with
So
harder classes, probably. Mhm.
yeah, so had we could have easily those first 3 months were lost, whatever, but we could have come back September 2020 strong. But we made school an option, and many kids who chose remote only, it wasn't because they were scared of COVID. It's because they knew that school was 3 hours once a week. Why bother going in and sitting in a classroom like a prisoner? Could have opened schools normally. The net gain, the net cost benefit of how many lives and cost and quality of lives would have saved would have been immense.
Right. Just two more things I want to cover. You touched a little bit on body image. I want to hear more about. I mean, high school and middle school are just weird ages.
Yeah.
You know, I can't imagine that this helped. And you've mentioned a couple things on Twitter in the short form on body image. I wonder if you could just describe the impacts that you think are happening in terms of body image, which is just so important, especially with social media and like the ideal body and stuff like that.
Well, and actually, the way you frame it is important because forget masks for a second. Being home for 18 months, all you have is social media. So you don't have those healthier in-person interactions. You don't have with teachers, with peers, right? Like, and depending on your family structure and your at-home peer group, like if you have a peer group that you can hang out with, like school was always a great equalizer. So you only had social media for many kids that it reinforces the poor body image. And then you come back to school, you have to wear a mask. And many kids, I think, hide behind that mask, um, not for COVID reasons, even when they're outdoors with their friends, because they see the mask as something that's going to save them or from having to expose their face, which they think is ugly, or they wear same reason kids wear hoodies, right?
Hmm.
Um, but it's just one additional layer. So yeah, I think body image as well as every form of self-esteem, mental health issue has taken a hit over the past 18 months. Taking masks away won't solve that, but I think it's time to do so to step in the right direction.
Yeah. So we take away masks. Like, where do we go from here, in your opinion, in terms of getting back to normal? Maybe, I don't know. Are those experiences just lost? Like, is that just are those kids that went through this just kind of wait till the next ones come around? Like, where do we go from here?
No, I mean, we never should have done this to these kids, but we certainly shouldn't give up on them, right? We definitely do intensive mental health supports and assessments of the kids who need them. I think getting rid of masks, it won't solve the problems of 18 months of closed schools, but step in the right direction. It helps kids relate better with each other and us with them, right? It's like it's not just wearing masks, wearing masks after 18 months of having those no relationships. So it's a double whammy there.
Hmm.
But I think that's where you go. I think, look, high schools have been vaccine eligible for 6 months. Elementary schools for more like 6 days. But give them a few weeks. By January 1st, there's no reason to have any mask mandate anywhere in American schools.
Great. I think that's really, I think what you're saying is really important for people to consider and hear. So is there anything that parents can do to advocate for such a policy change, or to advocate for their parent or for their children's mental health in ways that, like, that you would advise in handling this issue? Because I feel like this is something parents in the past have never had to experience. Like, my child has been socially isolated. So it's kind of a twofold question. How can they advocate for their children in terms of the effects of the pandemic on them? And also, what can they do to make that change to school policy?
Well, yeah, I mean, school policy is the harder one because then I would say band together, go to whatever city or town you're in, to the school board, to parents are the clients and we are a customer service business, right? So um, that's what parents could be doing on a policy level, but on a personal level, like you know, talk to your child, make sure your child maybe gets an appointment with the school counselor or social worker. That's a much easier ask on an individual level. Check in on your child because you just never know. Are there things that he or she have been bottling up? And no offense to the parents, but many kids aren't comfortable sharing everything with their parents. Making sure they have that opportunity to check in with a counselor after 2 years away from school almost.
Awesome. Yeah. So I think we can kind of wrap up. What I want to say is, I think it's important to remember that, you do your job for helping the mental well-being of children. And I just think it's super awesome, especially that, there aren't that many advocates vocally, doing that. And I think that's really awesome that you're doing that. And I think people need to remember that before they inject politics into something, that your job is to care for the mental health of kids. Um, so so before we wrap up, is there any places that people can go to follow you, social media? I know we've talked about that, but or any resources that you'd like to point people to, that are related to mental health, like anything that we can have here.
Yeah, I mean, they can follow me on Twitter at JUS Rangers, old name that I've had since I was probably a teenager. Um, but I mean, for mental health, I would say your best resources are probably local. probably in your school community. There, there's a national suicide hotline if, God forbid, any children are experiencing that. There's a Trevor Project for LGBTQ and ally, anyone really, but specializing in LGBTQ students, teenagers who need support as a crisis hotline. But yeah, and my DMs are always open if anyone has more specific questions.
I can attest to that. But yeah, I thank you again for what you're doing. Appreciate it. Thank you for joining this episode of the Opposing Points podcast.
Definitely. Nice speaking to you, David.